Going to the hospital can be a scary situation, especially for children. That's why GBMC has dedicated an entire team to putting them at ease. The team is made up of child life specialists who are tasked with supporting the youngest patients when they need it most. Joining me now is Jennifer Siler, one of the specialists at the hospital. Jennifer, welcome.
Thank you.
So explain to us, for people who don't know, what exactly is a child life specialist?
So we are a part of the multidisciplinary team, and our job is to help normalize the hospital experience for patients and their families.
So what do you guys do specifically with the patients?
So we do various different things. Play is the big foundation of what we do. So we offer a lot of normalizing play activities, may it be holiday crafts, arts and crafts, board games, card games, cars, those kind of things to make the hospital less scary and more normal for a patient. And then the other part of our job is to help prepare and teach about hospital experiences and the procedures that patients might be experiencing.
So how has this made an impact on GBMC?
So before Child Life came, the nurses and doctors are wonderful there, but there wasn't a lot for children to do. So there will be long wait times. They'll be very bored running in and out of their rooms. Now we have a play program where we can provide fun things to help keep them in their room, so the nurses and doctors can take care of the other patients. But now GBMC's vision is to treat every patient as if there was their loved one. So now we are able to extend that even further and individualize their care, trying to figure out what is going to help them cope the best through their hospitalization.
I can only imagine what a comfort that is, not just for the young patients, but for the parents. Can you describe that impact that you're seeing from them when they actually have the kids that are involved in your program?
Sure. So a parent's main job is to protect and prepare, and it's hard when there's a stressful event. So we work in an ER setting, and so a lot of times when they come in, they don't really know what's about to happen. They've never been through something like this before. So we not only focus on preparing the child for what's going to happen, but the child's looking for their parent for comfort. So if we don't prepare the family, it's not going to help the child cope through their hospitalization. So we work with the parents, understanding what's about to happen, what role they can provide. Maybe it's holding their child or singing, or being positioned into a room. So we really treat the family as a whole.
And what departments or units do you work in or with?
So currently we are in the pediatric emergency department and inpatient unit. It's a combined care unit. And then we're hoping to expand into other pediatric settings in the near future.
And how long has this team been around now?
So we have been here for about 1.5 years. We started last August, so it's a brand new service. And you don't have to make an appointment with us. If your child comes in, we will try our hardest to meet you.
It's such a unique experience that GBMC offers, and just sort of making it a community in very difficult times. I mean, no one goes to the hospital excited like, yeah, I want to be there. Right. But you guys make it a situation in which they can be a little bit more comfortable.
Absolutely. And it's definitely something where we want them to be comfortable with healthcare, because it's something we're hoping they're going to utilize as they grow up. So if we can get them, comfortable with their first visits, they'll keep going.
It's got to be a very, very fulfilling job that you have, you and your team. Can you describe that to me too, with your teammates? How you get, because it's been 1.5 years, it's still new.
Yeah, absolutely. So I love seeing the kid come in who is clinging to mom or dad or the caregiver, and they're terrified of us, and that's hard to see. But then once we get down, we get on their level. We play with cars, we help prepare for the procedure, may it be an IV, and then they leave saying, it wasn't as bad, I was really brave. That's the best part of our job.
You've done your job well. Thank you so much for your time. Really important service that you guys are offering at GBMC, and we'll be right back with more Midday Maryland right after the break. Stay tuned.